Good afternoon, Dr. Jimenez. We appreciate you taking the time to visit with us today. We're going to talk to Dr. Jimenez about pet life. He's one of our first veterinarians in the United States to actually work with the product in his clinic down in Miami, Florida. Dr. Jimenez is a Cuban descendant, but educated at some of the finest schools in the United States, Cornell, the University of Florida, and also Auburn. How would you explain how the venom works?
Like you just mentioned, being of a Cuban origin, I've been exposed to many different cases of either family members or people around you and you listen here and there that you have somebody that you know somebody that was treated or had a family member treated with this amazing Cuban discovery.
Yeah.
The truth of the matter is that this Caribbean blue scorpion is originally from the island of Cuba and the island of Hispaniola in the Caribbean. It's either Dominican Republic, Haiti, or Cuba. So having said that, they probably have, by nature, they have the miracle of having these scorpions in their territory. And yes, I know that the Cuban government was the first that started to develop the peptides, and they were able to extract this peptide from these creatures.
Doc, how can scorpion venom fight cancer?
Well, apparently the scorpion venom has some microelements. It does contain some microminerals in there that produce an apoptotic effect. What does that mean? Is that it means that these salts and these minerals will go into cells that are strictly malignant, and they will tame those cells, and they will, I don't know if the right term is to kill them, but it will make sure that the cells are not growing anymore. It's kind of hard to explain how it works, because that's probably part of the trade from Dr. McCallion, who was the one that developed with the Cuban government the polarization of this peptide, and I believe that he patented the polarization, which is the good thing about this, because people have the misconception that a venom is going to produce more damage than any other thing. And apparently the way that this drug works is by utilizing changes in the cellularity in the membranes of the cells to destroy these rapid mitotic cells by the effect of these minerals.
Tell us, without going into too great detail, you've treated 13 dogs and 4 cats, or 3 cats so far?
Well, we have treated 14 dogs.
14 dogs.
14 dogs and 3 cats in a period of 8 months.
Okay. Tell us a little bit about your study and what the results are. You also treated talk about the dog as well, that you were telling me that did not have surgery and did not have chemo, but just elected to go strictly on the product as well. And what kind of cancer that was?
I was just telling you before that I'm a very occidental in my way to thinking. I'm very skeptical by nature, so I mean, my scientific mind had to be convinced that this product was what it was meant to be. We put these patients on the medication for this period of 8 months, and there's 2 particular cases that they really caught my attention. One was a mixed breed dog that was diagnosed with an hemangiosarcoma. We did a full en-bloc extraction of the spleen. We removed the spleen, thinking about that, we were removing as well the entire malignant cellularity, and it was diagnosed. We did the biopsy. It was diagnosed with hemangiosarcoma. Just right after the just right after the extraction, the surgery, we placed this patient on the Escozine. And something remarkable happened. We had this client that all of a sudden the partner of this person came here looking for the medication, and in his words he said, Doc, I don't know if this medication is really working, but we ran out of it 3 days ago, and then all of a sudden the dog is not the same. We have a totally different dog. She's having some gastroenteric discomfort. She's not being the same. Can I please have more of that product? Which, I mean, just we followed up after that incident, and it happened that 3-4 days after they reestablished the usage of the medication, the dog just went back into normality. We have another case of a German Shepherd, 10-year-old German Shepherd diagnosed with osteosarcoma. We decided not to do anything invasive. We kept him the way he is. We just gave him a little bit of pain medication to manage some of the changes. We placed him on the Escozine, and just right after a month of usage, the owner, who is a doctor, is an MD, he sent his wife to get more medication because he's seeing the effects, the positive effects of this medication. So that tells you that whether you use the medication by itself, or you use it as a coadjuvant after a surgical procedure, or you use it as an addition into the therapy, whether you do chemotherapy or radiation therapy, is a positive.
Did you see any in the 16 pets that you treated? Did you see any negative side effects at all?
We had one client that brought the medication back, reporting that the medication produced some sort of lethargy in the dog. But in reality, I don't think that this client had the patient for enough time on the medication.
So the dog was lethargic on it, you thought?
It was lethargic after,
that's what he
3-4 days of the medication. So, but I don't think it was enough time for the trial.
Yeah.
The usage of Escozine as an added product, as an added medication into the therapy of a patient with cancer is really incredible.